Hi, my name is Heather Wakely. This is for my physiology class. Today is May 7th, and today I'm going to be talking to you about oral cancer. So the first thing I want to start out with is the anatomy of where oral cancer can happen. I have a diagram printed out for you. So here you can see a diagram of the mouth, and where oral cancer can occur is in the lips, the gums, the inside lining of the lips, teeth, the hard palate, which is the roof of your mouth, behind your wisdom teeth, right about here, are your molars, the underneath part of your tongue, and the first 2/3 part of your tongue. As you can see, the second part of 2/3 is actually part of the oropharynx, and that would be considered oropharyngeal cancer, not oral cancer. The oropharynx has a few different parts, like the tonsils, the back insides of your throat, and the back third of your tongue. So those are all areas of where oral cancer can occur. Now, how does oral cancer happen, right? We all want to know that. Well, oral cancer can happen for a few different reasons. Some causes are still unknown of why they mutate, but it's because of your DNA. The DNA in your cells actually mutate. A cause of the mutation can be tobacco use, such as smoking or chewing tobacco. Those are major contributors to oral cancer. Another cause could be poor fitting dentures. It can cause rubbing and lesions and red and white spotting or patches on the inside of your mouth. Like here, I have a picture of some white patching here. That's a picture of lip cancer. And then some red patching right up there. So these are all pictures of oral cancer and what it can look like and how it gets there. So let's talk about, again, like how it gets there, right? So how does it develop? Well, here, this is what's called leukoplakia, and that's the white or gray patching you see here. And then there's what's called erythroplakia, which is the red patching here. Let's talk a little bit more about that. So how does it develop, right? Well, first you start off with just a normal mucosa, and as things progress, it gets to like a white or gray patching, which is that leukoplakia that I showed you. And then as things start to progress a little further, it gets thicker and more fissured, as you can see here and here. And then as things progress a little further, it goes to what's called erythroleukoplakia, and that's a mixture of both the red and white patching. As things progress a little further and the cells mutate more, it turns into just erythroplakia. So if you notice any patching or anything like that inside your mouth, be sure to notify your dentist. So signs and symptoms of oral cancer include loose teeth, numbness or pain on the inside of your mouth, difficulty chewing or swallowing. If you've had a sore throat for a while and it doesn't go away, you really want to get seen. Also, if your bite is different, like if you close your mouth and you notice that something just doesn't feel right, that's another thing. Lumps on the inside of your mouth, and then strangely enough, ear pain. That can also be a symptom of oral cancer. So if you have any of those symptoms or a multitude of those symptoms, you should really get looked at. So treatments include sentinel node biopsies, radiation therapy, surgery, clinical trials, and chemotherapy. Now, a sentinel node biopsy is essentially just they want to check your lymph nodes to make sure to make sure that the cancer has not spread to your lymph nodes. Radiation therapy, that's considered, or a part of radiation therapy would be proton therapy, and that's to target the cancer cells and leave the healthy tissue alone. Clinical trials can be done through the Mayo Clinic. They have a lot of new stuff coming out all the time for treatments for oral cancer, and then chemotherapy as well. So those are some treatment options that you can look into. Here are my references, and I